Okay, this is section part 2 of the rules update presentation. In the first section, I just barely finished up with the IPS rule. And now we're going to talk about, well, I'm going to talk about the cross-connection control program. Every public water system, it doesn't matter if you're a teeny tiny campground or a big giant municipality, you have to have a cross-connection control program. Each program is required to have 5 components. Each of these components is worth 10 IPS demerit points. So if you're missing all of your cross-connection control program, that's a total of 50 demerit points on your IPS report. So there's 5 required components, and let's go over those. The first one is local authority, and that identifies a person who's in charge of the whole program. And this local authority has to be a written, like a policy statement or part of your bylaws for your city or town. And this statement requires protection for cross connections. It also has to require periodic testing of any backflow prevention assemblies. It has to require a hazard assessment. What a hazard assessment is it's when you do a walkthrough of your system to identify any possible areas where there could be a cross connection or backflow incident. And if you need help doing a hazard assessment, please call our office, because we have a gentleman who is in charge of our cross connection control program, and he can help you perform your first hazard assessment, or get other people that can help you get that done. So this local authority also identifies and authorizes any sort of enforcement methods that you need to do, as well as the inspection of new construction and existing privately owned public water systems. So first you have the local authority. The second thing is that you have to have public awareness or education on a yearly basis. And so this can be a bill stuffer, something that you put in the newspaper. You can make it part of a yearly town meeting. What most community systems do is they make it part of their consumer confidence report. The third thing is that you have to have trained or certified staff. This does not mean that you have to have staff that has gone through the backflow certification course, but it does mean that you have to have somebody on staff who has attended like an American Backflow Prevention Association evening seminar, or become certified, or there are the rural water seminars that we do, or you can call and request private training as well. The fourth thing is that you have to have records of your program activities. This means an inventory of your testable assemblies, an inventory of any health high hazard air gaps, inventories of records of your hazard assessment surveys, and any records of enforcement actions that you've had to do. The final thing that you have to have as part of your program for cross connection is ongoing enforcement. And this is just that everything that we've mentioned before is up to date. So your hazard assessment or surveys have been performed like within the past year or so, and any appropriate protection required has been provided. It also means that you're doing your annual testing of devices, and you're tracking that, and that your public education is current within the past year, and that you have any assemblies tested yearly. These are just some examples of what the hazard is, and then what the required protection is for that hazard. So if you have a sewage hazard, the required protection is an air gap, which is a minimum of 1 inch or 2 times the diameter of the pipe. That's the best form of cross-connection control for that type of hazard. For high hazards that are back pressure or back siphonage, we require the RP backflow assembly, which stands for reduced pressure. For high hazard that's just back siphonage only, we require the pressure vacuum breaker assembly, the spill resistant vacuum breaker assembly, or the atmosphere breaker device. There's the low hazards. If your low hazard is back pressure or back siphonage, we require the double check valve. If it's just back siphonage only, we require the PVB, the SVB, or the AVB. Source protection plans. A source protection plan is required for all new sources for all public water systems, but transient non-community sources built before 1993 are exempt from this requirement. Those systems have source water assessments instead. So it's easy to remember because our cross-connection control program had 5 required components, and so do the source protection plans. The first required component of a source protection plan is that you identify a designated person, somebody who is in charge. The second item is that you then go through and you take an inventory of all potential sources of contamination. So you inspect your system and you say, aha, these railroad tracks that come through here, this could be a source of contamination because UDOT sprays along this track line or something like that. So you inventory all your potential places where your water supply could be contaminated. And then once you have that inventory, then you prepare a management plan where you manage and prevent possible contamination events. And then it's always good to have a plan B. So that's the fourth item, is that you have a contingency plan in place for those potential sources of contamination. And then the fifth thing is the delineation. And the delineation is this on the next slide. The delineation shows where the water is coming from and the areas where you need to do your inventory and your management plan, because that's where your water is coming from, so, and where your source could become contaminated. So zone 1 is a fixed 100-foot radius around the source. That's always the same for all wells and springs. Zone 2 is anything that can get to your source within a 250-day time of travel. Zone 3 is anything that can get to your source within 3 years time of travel. And then Zone 4 is a 15-year time of travel. So that's your delineation. And then surface water obviously is going to be a little bit more difficult to pinpoint. It's not just a dot on the map. The zones for the surface water areas, the Zone 1 is half a mile from the high water mark, 100 feet downstream to 15 miles upstream. So it's a kind of a range. Zone 2 is 1,000 feet from the high water mark and an additional 50 miles upstream. Zone 3 is 500 feet from the high water mark. And then Zone 4 is the remainder of the watershed or to the state line. So part of your source protection plan includes monitoring waivers for VOC sampling and pesticide sampling. That's important to remember because those waivers are tied to your source protection plan. There's an implementation schedule that you have to follow for your source protection plan, and a resource evaluation that lists resources that you can use to implement your plan. And then your contingency plan must include all of your drinking water sources, so you're treating your system as a whole. And then you must notify the public that you do have the source protection plan. And usually this public notification, as before with the cross connection control program, that is part of the consumer confidence report, which is a yearly requirement. Okay, so let's talk about our water quality standards. This whole slide is in red because all of these things have been known to be questions on the exam. So primary drinking water standards, those standards are health-based standards where sampling is absolutely required. So like coliform bacteria, nitrate, sulfate, we have primary standards for those. We also have secondary standards. Secondary standards means that if you go over that level, you can smell it, taste it, see a coloration to the water, but sampling is not required and it's not going to impact public health. So secondary standards is not something that you have to worry about impacting public health. Some examples are like iron and manganese. Treatment technique, that's only for surface water treatment systems where you're adding chemicals to the water. There's limits on those. And then action levels is an action level is only for lead and copper. These, it's just another way of saying if you get to a certain level of lead and or copper in your sampling of your system, then you have to take action. So we do have the possibility of getting variances and exemptions for our water quality standards, but we do not do variances and exemptions for total coliform as well as we do not do them for the surface water treatment rule. And a variance or an exemption we have to be assured that it will not result in an unreasonable risk to human health. The variances that we give out have to be based on raw water quality, not post-treatment water quality. And exemptions are based on the availability of feasible treatment. We do give additional time to meet the MCL. MCL stands for maximum contaminant level, or the BAT, which is the best available technology. So it's easy to understand our monitoring requirements if you understand that they apply to where you take the sample. This first list of samples under distribution: coliform bacteria, lead, copper, asbestos, and disinfection byproducts, those are required to be taken in the distribution system. The list on the right-hand side under source, these lists from asbestos through radionuclides, these are required to be taken at the source before the water serves any customers. So as we go through this presentation, we're going to go through these distribution sampling requirements first, and then we'll go through the source ones. So let's do coliform bacteria. Coliform bacteria is an indicator bacteria. It's a whole family of bacteria. Some members of this family are black sheep and some are not. Some will make you sick and some won't. So all public water systems must sample monthly or quarterly for coliform bacteria. It's important to remember that the number of samples that's required is based on the system population. And it's also important to remember that a public water system has to keep records of their coliform results for at least 5 years. Chemical results are required to be kept by the system for at least 10 years. So let's look at the different type of systems and how often they sample. A community system samples every month, and then the number of samples they take is completely dependent on the number of people that they serve. The two other types of systems, the non-transient non-community systems and the non-community systems, they sample once per calendar quarter unless the system has a surface water source, or if the population during any 1 month exceeds 1,000. If those two items are the case, surface water or your population goes over 1,000, then those types of systems are sampling monthly. Okay, so when you are sampling in your distribution system, you need a sampling site plan. So for coliform bacteria, you have to have a plan that shows that your system is rotating the samples throughout representative sites in the system. You're covering different pressure zones. You're not taking the sample from the same house every single time. You're constantly moving through the system to check the water quality throughout. So this plan has to be written, and it's reviewed during the time of your sanitary survey. It's also reviewed if you have an event where you have like a boil order or some sort of quality violation with coliform bacteria. We'll ask to look at your sampling site plan. It's very important to know that your sampling plan has to have at least 5 sites or 2 times the number of samples that are required. So if your system is required to take 10 samples per month, your sampling plan needs to have 20 sites that are possible that you can rotate through. If you collect more than 5 samples a month, please, it's important that you do not collect them all on the same day. It's good to rotate them throughout the month, but it's also important to not take them during the last 3 or 4 days of the month, because that doesn't really give you enough time to respond and take repeat samples if your routine samples come back positive. It's also very important to know that the public water system is responsible for taking the coliform samples. It's not the Division of Drinking Water's responsibility or the local county health department or the laboratory. So if the sample is missed, the violation goes to the system, not to anybody else. So here's what happens. You find out what type of system you are. You find out how many samples you have to take. You go and you take your samples and you send those bottles to the laboratory. The laboratory tests the samples and marks the results. And the results that are possible are you can either have a satisfactory result, which means it was negative for total coliform, an unsatisfactory result, which means it was positive for total coliform but negative for E. coli, or positive for both, positive for total coliform and positive for E. coli. Those are both considered unsatisfactory. And then the last result that you can get is called indeterminate, and that means that there were interfering bacteria, so the lab was unable to determine if it was positive for total coliform at all. And in this case, if you get an indeterminate sample, you must take another routine sample within 24 hours. It's not a violation if you get an indeterminate sample. It just means you must take another routine sample within being notified within 24 hours. So if your results are satisfactory, then no further action is required. You just proceed on to the next month and follow your sampling plan. But if the results are unsatisfactory, you must follow up by taking repeat samples in the distribution system, triggered samples at the source, and possibly additional samples the next month. So let's talk about these routine, repeats, triggered, and additionals to clarify it better for you. Routine samples are just the regular samples required monthly or quarterly. Repeat samples, these are samples that you take in the distribution system after you get an unsatisfactory routine. You take these samples within 5 service connections upstream and downstream of the site that came back positive, as well as at the original site. Those are repeat samples. Repeat samples are in the distribution system after an unsatisfactory routine. A triggered sample is for a groundwater public water system. These samples are taken at all of the sources in use. And if a groundwater water system purchases water, then the wholesale system has to be notified so that they can take the samples at their sources. So triggered samples are the follow-up samples that have to be taken at the source for groundwater systems. If your routine samples were, if you had one or more routine samples that were unsatisfactory. Additional samples are for the small systems. These are for systems that take less than 5 routines per month, and these samples are marked routine on the lab form, and they make it so that the water system has a total of 5 routine samples the month following an unsatisfactory routine. So routines, repeats, and triggers are all taken in the same month. So if you have a positive routine sample in November, you're taking your repeats and your triggered samples in November, but then in December, that's when you take the additional samples. Additional samples are always the month following a positive sample. So if the result is unsatisfactory, the laboratory automatically checks for E. coli or fecal coliform, and then you go out and you take your repeat samples, and if you're a groundwater system, you take your triggered samples, and these are all taken within 24 hours of you being notified of your positive. And then the following month, you take the minimum of 5 routine distribution samples. Those are the additionals. But if you already take 5, 6, 7, 8, 9, 10, if you take 5 or more routines per month, you don't have to worry about this additional requirement. This chart shows you how many repeats you take. It shows you that if you take 1 routine sample a month, then you have to have 4 repeats for each total coliform positive. And then the month following, you have your regular routine plus your 4 additional samples the next month. So that's your total of 5 the following month. And then you can see if you have 2 or more routine samples required per month, then it's 3 repeats for each total coliform positive. So there's 2 main types of violations for the coliform rule. The first is a monitoring violation, and that's where you fail to take the routines, the repeats, and the additionals. So you just didn't take the right number, or you didn't take any of those required samples. That's a monitoring violation. A quality violation, that's when you have taken the samples, but they've come back positive and met these requirements for a quality violation. And if you have a quality violation, then you have to do mandatory health effects language in your public notice to your consumers. So a quality violation is there's two kinds. The first kind is a non-acute quality violation, and that means if you are a system that takes less than 40 routines per month, that means that you have had more than one total coliform positive sample in a month. If you take more than 40 routines per month, then you have a non-acute violation if more than 5% of your samples during any 1 month. Acute violations are confirmed fecal contamination, and what confirmed fecal contamination is it's 2 points in time. 1 point in time was at least total coliform positive. The other point in time was at least fecal positive. And acute violations are always a Boyle order as well. So this chart shows you what it looks like to have an acute violation. So you've got 2 points in time. 1 point is when you take the routines. The second point is when you take your repeats. At least one is total coliform positive, and the other one is at least E. coli positive. So you can see that you can have, here you can have a routine that's total coliform positive and E. coli positive, but the second point in time, all your repeats come back negative. They come back satisfactory. So this is not an acute violation. But these last three are an acute violation. Total coliform positive routine and an E. coli positive repeat, or total coliform positive routine and just a total coliform positive repeat, or both points in time have E. coli positive. So that is the definition of an acute quality violation. So let's go through some examples. This first example is if your routine is total coliform positive, you take all of your repeat samples and they all come back satisfactory. That is not a quality violation. And this next example is exactly the same. Number 2, no quality violation. Number 3, your routine is total coliform positive as well as E. coli positive, and one of your repeats at the second point in time is at least total coliform positive. This is an acute violation. 2 points in time, one is E. coli positive, the other is total coliform positive. Number 4, let's look at our 2 points in time. 1 point in time is at least total coliform positive. Another point in time is at least total coliform positive and E. coli positive. So this is an acute violation. This number 5 is also an acute violation because you have E. coli positive at both points in time, as is number 6, E. coli positive at 2 points in time. Number 7, this system is taking more than one routine per month, and let's say that they took both of these on the same day, and at one point in time you have E. coli positive, but you have more than one total coliform positive during the month, so this would be at least a non-acute violation right here. Number 8 is, you can tell by this example at the very top, 1 point in time is E. coli positive and the other point in time is just total coliform positive, so this is an acute violation. Number 9 is also 2 points in time. One is at least E. coli positive and the other is total coliform positive, so this as well is an acute violation because of this example right here. So the next section is the groundwater rule. The groundwater rule applies to all public water systems using groundwater. If you are a consecutive system receiving groundwater, and any wholesale public water system using groundwater. If you fit those categories, this rule applies to your system. So there's 5 components. Again, we love our number 5. 5 components to this rule. The first is that you have to take triggered samples at your source if you have a positive routine. The second is that we can assess required sampling to be taken at the source. There's corrective actions, sanitary survey requirements, and some compliance monitoring. So let's look at these. So the triggered source sample, are required when you have that routine coliform positive sample. How many do you take? Well, you take one for each active groundwater source. So if you have 20 springs that are active at the time when you took that routine sample, then you have to take 20 triggered samples. What if the triggered sample comes back positive for E. coli? Well, then you are required to take 5 additional source samples. Now, we do have an exemption, and that is that if your source is treated to 4-log removal, then it is exempt from having a triggered source sample taken from it. You should know if your sources have that 4-log treatment exemption. If you do not know, please contact our offices and we will fill you in. If you would like to get this exemption and you think that your source is treated to 4-log, then and you don't have it, give us a call and we'll talk about what needs to happen to get that exemption. Assessment samples. This is a requirement that the division director can do at his or her discretion for sensitive sources, such as you've redeveloped a spring, or you have a source that has a history of positive samples, or sources that have no plan approval or operating permit. Then we come in and we say you have to do 12 monthly samples required at this source for total coliform and E. coli. And then after that 12 months of E. coli sampling at that source, then we decide whether or not to take that source off of assessment sampling. Corrective actions are required when you have confirmed positive E. coli samples at your source, and any uncorrected significant physical deficiencies at the source that are noted at the time of the sanitary survey. Corrective actions are required to be done within 120 days or the Division of Drinking Water approved correction action plan deadline. So that means if we've decided on an action plan for you to fix that item, you have to meet that deadline. Sanitary surveys, what the groundwater rule has done to sanitary surveys is it's required 8 elements for the surveys that go through operation and maintenance, sources, treatment, checking, all of these things. All of these elements we're checking at the time of the survey. And it also makes it a requirement that the water system should receive a report on the sanitary survey findings within 30 days of completion of the survey. And then finally, compliance monitoring. Compliance monitoring is required only for sources that have the 4-log exemption. And what is included in this is an engineering reviewed minimum dosage is required for these sources. And then we do the chlorine residual samples. So if your population is over 3,300, you have to do continuous monitoring of your chlorine residual. If you're under that 3,300, you do the daily grab samples. And then this reporting is combined with your quarterly disinfection byproduct reports. And then in this next section of this presentation, we'll go in and talk about violations and quality.